Next natin yung laboratory tests related to cardio and your hematology. First, you have here your coagulation test, yung ating prothrombin time, at saka yung ating activated partial thromboplastin time. Dito muna yung tingin sa harapan. Now, main problem, sabi natin, when it comes to your cardiovascular, it will all start through your coronary artery disease. Di ba lahat mag-start yan sa coronary artery disease, arteriosclerosis, and atherosclerosis. Now, to prevent further neurologic deficit, for example, nagkaroon ng stroke, nagkaroon ng thrombus or embolus sa blood vessels sa brain, we want to prevent further neurologic deficit by giving medications such as your anticoagulant. Sorry. Precious pala ng pressure. Okay. We will give your anticoagulant, okay? So that there will be decreased blood coagulation to prevent further neurologic deficit kung stroke. Kung MI naman, we want further coagulation so that we would promote further oxygenation of your myocardium. Hence, we give your anticoagulants. Anticoagulants, your antiplatelets, at saka yung thrombolytics natin. Unahin muna natin yung anticoagulants natin, okay? Unahin muna natin yung anticoagulants. Dito muna yung Wi-Fi natin. Okay, unahin ko muna yung ating anticoagulants. So you have your anticoagulants. Then, yung mga laboratory na related when we are giving your anticoagulants. Your anticoagulants, tatandaan nyo lang yung ating Harry Potter, yung favorite na movie natin, si Harry Potter, at saka yung ating favorite na brand, okay? Yung ating Calvin Klein, okay? Yung Calvin Klein, yung favorite na brand natin na Calvin Klein. Now, we have two types of your anticoagulant that we will be giving to patients who have thrombus or embolus. Okay? Letter H, you have here your heparin. Okay? Yung heparin. Si heparin ay isang short-acting anticoagulant. Okay? Short-acting anticoagulant. Your heparin is mainly given through subcutaneous or IV. Okay? Your heparin is usually given or is given subcutaneous and IV. Pag binigay mo yan subcutaneous, are you going to massage? Bakit? Anticoagulant siya, therefore, it could cause bruising. Pwede magkaroon ng bruising. Okay? So we will not massage. Alam ba yung gamot na binibigay subcutaneous na hindi mo rin minamassage? Insulin. Sa pag pinasage mo yung insulin, mabilis magkaroon ng hypoglycemia. If we will give through subcutaneous, ang gusto nating effect kasi ay sustained or maintained effect. Bakit ka magbibigay ng gamot through subcutaneous? Because we want an effect na sustained, maintained, or slowed effect. Okay? Now, your Coumadin, letter C here is your Coumadin. That is also known as your warfarin sodium. Your warfarin sodium. Okay, your warfarin sodium or Coumadin. Your Coumadin class is a long-acting. Okay, it is a long-acting anticoagulant. Long-acting anticoagulant. Binibigay natin yan oral or per orem. Oral tablet yan, yung ating Coumadin. Your Coumadin is long-acting because the therapeutic effect of your Coumadin could only be seen 2 to 3 days. Makikita mo lang ang effect ng Coumadin natin after 2 to 3 days. So question, can you give both heparin and Coumadin at the same time?
Yes.
Yes. Because while waiting for the effect of your Coumadin, meron tayong fast-acting at short-acting na heparin. Ang hindi pwedeng i-combine ay yung anti-platelet medication natin na aspirin. Heparin and aspirin, no. Bleeding. Okay? Coumadin and aspirin, hindi din pwede. bleeding din. Baka natin. Pag heparin and coumadin, pwedeng bigayan together because while waiting for the effect of coumadin, meron ka ng anticoagulant na short and fast-acting na heparin. While giving your heparin, kailangan meron ka sa bedside na antidote niya, si protamine sulfate. Meron ka dapat na antidote sa bedside, si protamine sulfate. Protamine sulfate. While when you are giving coumadin, yung antidote niyan ay vitamin K. Vitamin K. Example ng vitamin K natin ay yung aquamephyton. Your aquamephyton, that is vitamin K. Ano pa? Yung menadione. Your menadione. These are vitamin K plus your GLV. Green leafy vegetables. Your GLV. Green leafy vegetables. Green leafy vegetables are rich in vitamin K. So, when the patient is taking coumadin, bawal kumain ng green leafy vegetable. Mawawalan yung effect ng ating coumadin. Kuha? Against yun? Because green leafy vegetables are rich in vitamin K. Now, when giving heparin, you have to monitor for the PTT or partial thromboplastin time. PTT or partial thromboplastin time. So when you are giving your heparin, kailangan nakamonitor daw sa PTT or partial thromboplastin time. Ang normal mo dyan, nasa 60 to 70 seconds. Depende sa libro at sa laboratory na ginamit. Or at saka yung isa, yung activated partial thromboplastin time. Si APTT. Your APTT, ang normal mo dyan, nasa 30 to 40 seconds. Ang normal value natin for your activated partial thromboplastin time. Now, the question sa exam is, when will you know that you are on the therapeutic level? Kailan mo daw malalaman na nasa therapeutic level ka na ng medication? If you are 1.5 to 2 times the normal value, you would know that you are on a therapeutic level if you are 1.5 to 2 times the normal value. So for example, we are monitoring for the PTT. I-multiply mo, 60 times 1.5, that is equivalent to, anong sagot? Calculator. 60 times 1.5. Ano yun? 90, tama? 60 times 1.5. So you have there 90 to 100, 42 times 70. Edi 140. Ibig sabihin, ito yung iyong therapeutic level. Nasa therapeutic level ka. If you are 1.5 to 2 times the normal value of PTT and APTT. For example, ang nakuha ko ay 200. Ibig sabihin, prolong ang kanyang bleeding. Prolong ang bleeding time. Kailangan na, ano yung antidote natin? Sagot? Ano yung antidote? Protamine sulfate. So, bibigyan mo na ng protamine sulfate because it's beyond already the therapeutic level. The patient is prone to bleeding. If the value is 40 naman, nako, baka kulang ang dosage ng heparin. Kulang yung dosage ng heparin. Nako, ngayon, if you are 1.5 to 2 times the normal value, sir, when will I know if I'm on the therapeutic level of coumadin? Sa coumadin naman, ang minomonitor natin ay prothrombin time. Prothrombin time. PT or prothrombin time. You would know that you're on a therapeutic level if you are 2 to 2.5 times the normal value, which is 12 to 16 seconds. Yung normal value ng PT natin ay 12 to 16 seconds. And yung isa, yung international ratio, INR. Ang normal INR ay 1 to 2. International ratio, that is 1 to 2. Okay? So, ibig sabihin, sir, paano mo malalaman na nasa therapeutic level ka? I-multiply mo ulit. 12 times 2, that is equivalent to 24. And then 16 times 2.5, calculator nyo nga. 40. 40. Okay. So 24 to 40, that is your therapeutic level. Therapeutic level. So ibig sabihin, kung nakakuha ako ng 80 na prothrombin time, ibig sabihin, the patient is at risk for bleeding. Bibigyan mo ng vitamin D, or encourage mo kumain ng green leafy vegetable. Eh nakuha ko ay 10. Kulang sa dosage, or baka naman nung iniinom niya ang Coumadin, kumakain siya ng green leafy vegetable kasi nga antidote ng Coumadin. Now, when are we going to stop taking heparin? Diba you're taking both heparin and Coumadin at the same time? When are you going to stop taking your heparin? If nasa therapeutic level ka na ng Coumadin. Tama? Stop mo mag-take na ng heparin if you're on the therapeutic level of your Coumadin. Because if you are still taking Coumadin, okay, while you are on the therapeutic level, the patient is at risk for bleeding. The patient is at risk for bleeding. Pero merong hemorrhagic stroke, bibigyan pa ng anticoagulant? May hemorrhagic stroke, aneurysm, bleeding, it's the cause of the stroke. Bibigyan ba ng anticoagulant? No, hindi lalo makakaroon ng bleeding. Hemorrhagic stroke, the only treatment for that or management is emergency craniotomy. That's the only management for hemorrhagic stroke, emergency craniotomy. Pero pag thrombus embolus, pwedeng bigyan? Yes, pwedeng bigyan. Pero pag sasabayin mo, heparin and aspirin? Heparin and aspirin? No. Heparin and Coumadin? When are you going to stop your heparin? Therapeutic level ka na ng Coumadin. Good job. Next, we proceed to your anti-platelet and thrombolytics. Okay. Meron tayong gamot na anti-platelet. Okay. Your anti-platelet at saka yung ating thrombolytics. Anti-platelet and your thrombolytics. Anti-platelet, sinabi ko na any injury doon sa katawan natin, external or internal, platelet would go to that injury. Therefore, platelet would aggregate on that area if there is an injury in your blood vessel, resulting to decrease perfusion. Hence, magbibigay tayo ng anti-platelet medication to decrease platelet aggregation. Okay? Ba't ka magbibigay? To decrease platelet aggregation or agglutination. Aggregation or agglutination. Anti-platelet, ito yung pinakasikat natin, si acetyl salicylic acid. Your aspirin, acetyl salicylic acid. Other drugs include, baka ito ang tanongin, si dipyridamole. Dipyridamole. Or another drug, si ticlopidine. Ticlopidine. Pero yung nakikita nyo doon sa ward, ito yung common na binibigay. Si clopidogrel. Clopidogrel, this is also known as your Plavix. These are all anti-platelet medication. Anti-platelet medication. So pag na-stroke ako, pwede ba ako mag-maintenance ng anti-platelet medication?
Yes.
Yes, to prevent further obstruction doon sa my blood vessel. Because remember, compensation of your body is that platelet will go to any site of injury, maka sa loob man yan o maka sa external man ng katawan. And kung nagpunta doon sa blood vessel na may injury, it will further decrease the blood perfusion. Hence, we give your anti-platelet medication. Okay, now aside from your anti-platelet medication, meron din tayong isang binibigay na class ng drug, your thrombolytics. Okay? Si thrombolytics. Your thrombolytics. Thrombolytics class, lytics, ibig sabihin, dissolve. Okay? Ang ginagawa niya, dinidissolve niya or nilalize yung clot. Okay? Dissolve or lyse your clot. But remember, thrombolytics are only effective within 6 hours. Effective lang ang thrombolytics natin within 6 hours. Sir, kaya pala, di ba anong tinatanong doon sa ER? Anong oras na stroke si sir, si ma'am? Bakit? Because we want to know kung anong oras because we want to know what drug will be given. Ang thrombolytics, effective lang yan within 6 hours after the attack. Hindi na yan effective kung more than 6 hours at na-stroke yung pasyente. Kung more than 6 hours, ang ibibigay na ay anticoagulant or your anti-platelet. Pero hindi sila pwedeng pagsabayin. Nakuha natin. So, thrombolytics are only effective within 6 hours. Lahat ng gamot na yan ay mayroong ACE sa drug name ending. Lahat may ACE sa drug name ending. Ito yung ating alteplase. Alteplase. Another drug, si streptokinase. Streptokinase. At saka yung isa si tissue plasminogen activator, yung TPA natin. Alteplase, streptokinase, and your tissue plasminogen activator. Most of the drugs may ACE lang yan sa drug name and ending. Alteplase, streptokinase, and your TPA. Effective lang within how many hours?
6 hours.
Within 6 hours. Beyond 6 hours, ano ibibigay na natin? Or anti-platelet. Pero pwede pagsabayin ang aspirin at yung heparin? No. Bibigyan ng anti-platelet yung pasyenteng may hemorrhagic stroke? No. Okay, hindi bibigyan kasi nga ang hemorrhagic stroke, ang only treatment or management natin ay emergency craniotomy. Okay, so that is your thrombolytics. Dissolve lyse clot, but effective only within 6 hours after the attack. So we're done. That's why importante yung bleeding parameters natin dito when it comes to your cardiovascular disorder that we want to monitor. Other laboratory testing includes yung BUN natin na 10 to 20 or 5 to 25 milligram per DL. Okay? Your BUN, ano mas reliable? Creatinine or BUN? Creatinine. You know already why. Because your BUN can be affected by 3 factors: hydration, exercise, and high protein in your diet. Next, alam mo na rin itong cholesterol. And we discussed already. Tapos na natin yung drugs dito. Yung sa cholesterol natin. Are we done with the drugs used for your cholesterol? Yung mga statin natin. Statin? Wala pa? Okay. Okay, now we're for cholesterol level, para minsanan na, para mamaya doon sa discussion sa sakit, signs and symptoms na lang, and we are done. Ganun na lang yun. Now, for your cholesterol, ano ba yung mga ginagamit natin for increased cholesterol level? Unahin natin yung pinaka-common, si anti-lipidemic drug, or anti-lipidemic drug. Anti-lipidemic drug or anti-lipemic drug. Okay? Ito yung ating mga drug na merong statin. Yan yung mga statin natin. Simvastatin. Okay? Simvastatin. Atorvastatin. Okay, basta merong statin lang yan, anti-lipidemic drug to lower your cholesterol level. Now, the question here sa anti-lipidemic drug is when are you going to give this? AM or at the evening? Sagot? Evening. Bakit evening? Bakit evening? Because cholesterol synthesis happens at night. Cholesterol synthesis happens at night. Bakit evening binibigay ang anti-lipidemic drugs natin? Because cholesterol synthesis happens at night. Okay, cholesterol synthesis happens at night. Okay. So, bibigay natin ang ating mga statin in the evening. Okay, in the evening. It happens at night. Okay. Another reason kung bakit evening binibigay, aside from cholesterol synthesis happens at night. Evening binibigay yan because you want to prevent the effect of rhabdomyolysis. Okay? You want to prevent the effect of your rhabdomyolysis. 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 Rhabdomyolysis, meron tayong muscle weakness. Okay? Okay, meron tayong muscle weakness. Muscle weakness. Eh kung umaga mo binigay yan, if you give your drug in the morning na anti-lipidemic, for example, your simvastatin, at kung may rhabdomyolysis resulting to muscle weakness, eh di ba umaga ginagawa ang activities of daily living umaga? Eh di pasyente at risk for what? At risk for injury. Kaya gabi yan, pagbigay mo ng gabi, di matutulog na lang yung pasyente. Decrease ang risk for injury. Okay, so binibigay yan in the evening because cholesterol synthesis happens at night, and because of the effect of your rhabdomyolysis, which is muscle weakness, that may result to risk for injury. Because in the morning, the daytime, doon ginagawa ang activities of daily living. Okay, your anti-lipidemic drugs na simvastatin. Now, other drugs for cholesterol, yung ating bile acid sequestrant. Other drug for cholesterol is your bile acid sequestrant. Bile acid sequestrant. Bile acid sequestrant. Ito yung gamot na cholestyramine. Okay, yung gamot natin na cholestyramine, or this is also known as your questran. Okay? Your cholestyramine or your questran. A bile acid sequestrant drug, your cholestyramine or questran. Now, tingin mo na sa harapan, dito mo na itingin, ano yung ginagawa ng bile acid sequestrant natin? Your bile acid sequestrant decreases, your bile acid sequestrant, unang yung ginagawa, it decreases the bile. Okay? Decreases the bile by eliminating the bile through your feces. Okay? By eliminating the bile through your feces. If bile is eliminated through your feces, bile could cause constipation. So while taking your cholestyramine or questran, you need to increase fiber in your diet. Okay? Kailangan i-increase mo ang fiber sa diet while you are taking your questran because bile could cause constipation. Ngayon, question class. Question. Normal ba na i-eliminate natin ang bile? Is that normal process of your body? The answer is no, because bile is needed for fat digestion. Tama. Kailangan natin si bile kasi for fat digestion. Therefore, abnormal yan. Tama. Mararamdaman ngayon na nag-decrease ang bile. Sino ba nagpo-produce ng bile? Mararamdaman yan ni liver. Mararamdaman ni liver na pakonti yung bile because it's being eliminated through your feces because you are taking your questran. Now, mararamdaman ni liver yan, ang gagawin ni liver, magkakaroon ngayon sa liver ng oxidation. Magkakaroon sa liver ng oxidation. That is a compensation of your liver because of the bile that is decreasing. Now, because of oxidation by your liver, the byproduct of oxidation is an increase in your bile. An increase in your bile, but the good effect of oxidation is a decrease in your cholesterol. Okay? So that's the effect of your oxidation by your liver because of a compensation due to a decrease in your bile as it is eliminated through your feces. Ngayon, since na-eliminate ngayon si bile, since in-eliminate mo si bile, okay, ano ulit yung ating, ano ulit itong mga to, class? fat-soluble vitamins. Therefore, if you are taking cholestyramine, increase ang absorption ng fat-soluble vitamins because you need bile so that added is or will be absorbed by your body. Okay? So, increase ang ang absorption ng fat-soluble vitamin natin na added. Eh kung walang vitamin K, anong pwedeng side effect? Bleeding. Kailangan ba i-check ang prothrombin time? Yes. Pag walang vitamin A at walang vitamin E, ano pwedeng mangyari? The patient is at risk for infection. Yeah. Ano ba yung kailangan natin para sa healthy immune system natin? Foods rich in vitamin A, C, E, and zinc. Diba? Yung pagkain na kailangan natin to boost the immune system, foods rich in vitamin A, C, E, and zinc. Okay? Eh, hindi na-absorb si vitamin A and E, the patient is at risk for infection because of decreased immune system. Eh, paano pa hindi na-absorb naman si vitamin D? Ano mangyari? Vitamin D is needed for the absorption of calcium in the intestine. So, pag hindi na-absorb si vitamin D, hindi na-absorb si calcium, the patient is at risk for osteoporosis or fracture. Okay, so that's the effect of your bile acid sequestrant. And remember, most of the drugs are fat-soluble. Most of the drugs are fat-soluble because fat-soluble drugs are easily absorbed. Because the intestine, the lining of your intestine is made up of lipid. Bakit mas madaling ma-absorb ang fat-soluble drug? Because the lining of the intestine is made up of lipid. Hence, most of the drugs are fat-soluble. Eh kung fat-soluble ang most of the drug, and you are taking Questran together with other drug, eh di ba in-eliminate mo si bile, decrease ang absorption ng ibang drugs natin. So never combine your Questran with any other drugs. Never combine Questran with any other drugs because most of the drugs are fat-soluble. And when you are taking Questran, you are eliminating the bile that is needed for fat absorption, fat-soluble drug absorption. Okay? So never combine with any other drugs. Now, as an effect, kung titignan mo yung laboratory, mag-improve ang kanyang HDL or LDL. Ano ba yung good cholesterol? HDL. So, bababa ang LDL, tataas ngayon ang HDL when you are taking your bile acid sequestrant. Okay. So, those are the drugs used for high cholesterol level. Yung ating anti-lipidic drugs in your bile acid sequestrant. Ano yung intervention mo when the patient is taking bile acid sequestrant and since bile is eliminated to your feces, high fiber and increased oral fluid intake. Okay, that's for your bile acid sequestrant. Okay, we're done with your blood lipids. Blood cultures, pag meron tayong infection. Okay, blood cultures, pag meron infection. Ayun, culture and sensitivity testing. Culture and sensitivity testing. Culture to check for the specific microorganism. While S, sensitivity, you want to check for the specific drug that is effective for that specific microorganism. Culture and sensitivity testing. Culture to check for the specific microorganism, while sensitivity to check for the specific drug that is effective for that specific microorganisms. Okay, next natin, other enzymes. You have your CKMB at saka yung troponin natin. First, to increase, you have your CKMB, but more specific yung ating troponin. Ito yung ginagamit natin to check for cardiac damage. Okay? Saan yan? Myocardial infarction. Okay? How would you know na merong MI? Increase yung dalawang enzyme, CKMB, and yung troponin. Yung troponin natin. Okay, troponin is more sensitive, pero dalawa yan mag-increase during MI. Yung LDH at saka AST, okay, LDH and AST, hindi na yan ginagamit ngayon as cardiac marker. Hindi na ginagamit yan as a cardiac marker because LDH and your AST are what? Non-specific enzyme. Non-specific enzyme. Pwedeng mag-increase ang lactodehydrogenase and aspartate aminotransaminase kung meron kang muscle injury, kung meron kang brain injury, kung meron kang liver damage, or meron kang cardiac muscle damage. So, ibig sabihin, they are what? Non-specific. Non-specific. Non-specific ang LDH and AST. Ang HBD, hydroxybutyrate dehydrogenase. Ang HBD, hydroxybutyrate dehydrogenase or HBD, lagay mo lang dyan. Ang HBD class, matagal yan mawawala, even days. Okay? So, paano mo malalaman na nagka-MI ang pasyente after 5 days? Yung HBD ang kukunin mo. Because CKMB and troponin will disappear after 24 to 48 hours. Mawawala din yan. Okay, pero first yan na mag-increase, not HBD. But if you want to know if 1 week nang nakalipas at nagka-MI ang pasyente, si HBD ang kukunin natin. LDH and AST, hindi na yan ginagamit as a cardiac marker because they are what? They are non-specific. They are non-specific. Okay, other things related when it comes to cardiovascular, urinalysis natin, albuminuria. Ano yung kung merong albuminuria, anong simptomas ang makikita natin?
Edema.
If there is albuminuria, anong simptomas? Edema, tama? Okay, edema, yung oncotic pressure. Myoglobinuria, ito yung result of a muscle damage. You know, hazing, yung pinapalo-palo, hazing. Saan namamatay ang pasyenteng nag-hazing? Saan namamatay ang pasyenteng nag-hazing? Is it because of the bleeding, bruises? Because of what? Acute renal failure. Because of acute renal failure. Ano yung cause ng acute renal failure doon sa pasyenteng pinalo-palo nag-hazing? Because of myoglobinuria, because of muscle damage. Ang myoglobin kasi, malalaking substance yan. Okay? And this malalaking substance, like myoglobin, if they will pass the glomerular filtration rate, yung sa ating glomerulus, masisira ang glomerulus, resulting to acute renal failure. Ano yon? Intrarenal. Diba meron tayong tatlong cause ng renal failure? Pre-renal, intrarenal, and post-renal. Yung hazing na pinalo, nagkaroon ng muscle damage. Muscle damage equals myoglobinuria. Okay? Presence of myoglobin in the urine. Wala dapat myoglobin sa urine. Because myoglobin are large particles that your glomerulus could filter. At kung maraming myoglobin, pwedeng sirain ang filter, resulting to acute renal failure. That's the main cause of death of patients na nag-hazing, okay? Na hazing, na pinalo-palo because of myoglobinuria. Abnormal. Okay, resulting to what? Ano yun? Acute renal failure. Acute renal failure. Okay, other tests includes VDRL. Ano yun? VDRL natin. VDRL, this is your venereal disease research laboratory. Pasyenteng merong syphilis. Okay? Pasyenteng merong syphilis. Because syphilis, the late stage of syphilis could cause cardiac damage. It could cause not only cardiac damage, brain damage, and liver damage. Ano yung ating syphilis ulit? Yung syphilis natin, your syphilis, sexually transmitted disorder, your syphilis caused by your microbiome, treponema, ayun. Si treponema pallidum. So if you want forever, kung gusto mo ng forever class, ito walang forever. Pero kung gusto mo ng forever, ito, okay, magsipilis ka. Ang sipilis kasi hindi yan nawawala sa katawan mo. Forever yan na meron sa'yo. Kaya kung gusto mo ng forever, ayan, magsipilis ka. Okay? So your treponema pallidum or your syphilis, merong stage yan. Okay? Merong stage. Okay, unprotected sex, yung main mode of transmission. Number 1, meron tayong tinatawag na primary syphilis. Meron tayong tinatawag na primary syphilis. Primary syphilis, anong makikita? Okay? Ano makikita sa primary syphilis? Meron tayong presence of chancre. Chancre, these are painless. Okay? Painless blisters. Okay? Painless blisters sa may vagina or the penile area of the patient. Okay? Your chancre. Plus, meron tayong lymphadenopathy na localized. Okay? Localized lymphadenopathy. Ano yung ibig sabihin ng adenopathy? Inflame ang mga lymph nodes sa may singit dito. Kapag may mga lymph nodes tayo dyan, inflame ang lymph nodes. So meron tayong localized lymphadenopathy. Okay? Inflammation of your lymph nodes sa may groin area. Sa may groin area. Now, even without treatment, kahit wala kang gawing treatment dyan, kahit wala kang gawing treatment, kusang mawawala si chancre. Pero hindi ibig sabihin na wala ka ng syphilis. Kusang mawawala si chancre, pero hindi ibig sabihin na wala ka ng syphilis. Sabi ko nga, sa syphilis may forever. Meron tayong tinatawag na secondary syphilis. Secondary syphilis. Your chancre, mapapalitan si chancre ng mas malaki na sugat, ang tawag mo doon, si condylomata. Condylomata lata. Your condylomata lata. Si condylomata lata ay bigger in size and color white. Bigger in size and color white. Dito, kanina merong localized lymphadenopathy. However, pag nasa secondary syphilis ka na, magkakaroon ka ng generalized lymphadenopathy. Generalized lymphadenopathy. Lahat na ng lymph nodes mo inflame. Kahit yung sa may cervical lymph nodes dito, inflame na yan sa secondary. Okay, number 3, okay, mawawala ulit ang condylomata lata. Mawawala ulit yan. Okay? Mawawala ulit yan kahit wala kang gawing treatment. Mawawala yan. But that doesn't mean na wala ka ng syphilis. Meron tayong tinatawag na latent syphilis. Okay? Ang next mo na dyan ay yung latent syphilis. Latent syphilis. Latent syphilis, the patient is still reactive, positive ka pa rin. Okay? Reactive ka, pero hindi ka na infectious. Non-infectious. Okay? Non-infectious. Reactive ka, pero non-infectious ka na. Okay? Reactive, but you are non-infectious. Number 4, okay, pwede umabot yan up to 10 to 15 years na meron tayong tinatawag na late syphilis. Meron tinatawag na late syphilis. Sa late syphilis, non-infectious ka rin. But, ito yung tinatawag nating destructive type. Destructive type na syphilis. destructive type. Non-infectious, but that is your destructive type of syphilis. Dito, bakit sinabi tinawag na destructive? Kasi meron ng damage. Okay? Damage to several organs like your heart, okay, liver, and brain. Okay? Meron na tayong damage to several organs like your heart, liver, and your brain. So, forever ka merong syphilis. For your management for syphilis, yung walang katapusang penicillin. Drug of choice for your syphilis is your penicillin. Kaya anong class? Lights on o lights off? Ha? Lights on o lights off? Lights on. Assessment ka. Assessment. Bakit may blister? Bakit iba yung amoy? Foreplay ka muna, mga isang oras. Kapaka ka muna, bakit inflame? Kaya lights on o lights off? Lights off. Check nyo lang, baka may camera. Nasa Twitter ka na. Diba? Okay, now for sexually transmitted disease, meron tayong program by your Department of Health. Okay? Meron tayong pag gano'n, buhay na buhay. Forces against STD, sabi ng Department of Health. Sige, pasok ko na rin yan. Parang pagpasok niya. Okay. Pasok natin itong forces against STD by Department of Health. Number 1, nasa white book yan. Nasa my page. Nakalimutan ko na yung page. Contact, dati memorize yung page yan. Contact tracing. Okay. Number 1, contact tracing. Number 1, letter C sa STD ay contact tracing. So, ibig sabihin, hindi lang yung wife ang magkagamot, pati yung asawa, si driver, si kapitbahay, si kagawad, buong barangay, mag-medication. Yung contact tracing. So, dahil seryoso guys, contact tracing. Nakuha yung concept ng contact tracing. So lahat sila, therefore, mag-medication. Number 2, kailangan natin ng compliance to medication. Compliance to medication. Pag hindi na kompleto kasi yung antibiotic, pabalik-balik yung mga STD. Yung pinaka-common dyan yung gonorrhea or tulo. Compliance. Number 3, syempre kailangan ng condom. Okay? Kailangan ng condom. Remember, only condom is it's the only contraceptive that could protect you against STD. It's the only contraceptive that can protect you against STD. And number 4, sabi ng ating Department of Health, kailangan ng counseling. Huwag ka kasi maglandi. Mali yung klasahan. Huwag gayahin yun. That's non-therapeutic. Hindi yun therapeutic. You do not judge your patient. Kahit may STD, hindi mo pa rin siya i-judge ng gano'n. Okay? So, counseling. Okay? Counseling. Okay? Mali yung sinabi ko. That's non-therapeutic. Kahit anong trabaho ng ating patient, never judge the patient. Never ever judge the patient. It's not our role to judge them, but to treat them and encourage them that life is worth living. Okay? That's our role. Counseling. Forces against STD. Pasok pa talaga yun. Forces against STD. Pero meron naman akong forces according to Sir Ivan. Meron akong A, B, C, D. Letter A yung pinaka-effective talaga. Abstinence. Letter B. BJ. B. Be faithful. Pwede naman yun. Pero pwede pa rin magka-STD dyan. Be faithful. Okay? Be faithful. Okay. Ano pa? Condom. Tapos letter D. Diba? Order ka lang sa shop. Para naman. Order sa shop ng Dito. Ayaw mo ng dito. Ito. Ito, very organic to. Very organic. Kaliri. Ito yan? Magdaliri ka na lang. Pero be sure na yung hand washing. Baka naman di ka nag-hand wash. Wala kang STD. Nagka-infection ka na lang. Kasi hindi ka nag-hand washing. A, B, C, D. To against STD. Okay, that's it for your... Ewan mo nila kung makalimutan mo pa yan, ha? That's for your CJs. We need VRTL. At VRTL is the test, diagnostic test for your syphilis. Kailangan yun para malaman natin if the cause of cardiac problem is due to syphilis. So you have there your VRTL for your syphilis. Okay, and of course, alam na natin ito, class. Okay na tayo. Move on sa daliri at builder. O kaya ano dapat? Self-support na lang. Diba? Self-support. Okay. Next natin, serum electrolytes. Remember, pinaka-worst dito yung pag meron tayong imbalance sa potassium because it will always lead to cardiac dysrhythmia. Okay. Tatandaan, bakit kailangan i-monitor ang serum electrolytes? Cardiovascular naman yung problema. Remember, common cause of death, it's not MI. MI because ang complication of MI is cardiac dysrhythmia. And major cause of cardiac dysrhythmia is electrolyte imbalance and especially your potassium. So check lang natin yung normal values natin for serum electrolytes. Ano makikita sa ECG pag mayroong hypokalemia? Hypo, presence of alam mo na yun. Okay, presence of your urine. In hyperkalemia, 50 weight. Okay, that's for your serum electrolytes. We are done with your ECG, tama? Electrical activity of the heart, diagnosis for cardiac dysrhythmia. Ano yung ating major pacemaker muna? Review muna natin. Yung SA node. Nasa pabalang yan ng inyong inferior vena cava. Superior vena cava. Nasa may right atrium. Then papunta saan? SA to your AV node. And then yung ating bundle of his and then your Purkinje fibers. Okay, then ito yung placement natin. Okay, at okay, alam natin ito, especially when you have your duty sa ER. Pag sa ER kayo, dapat alam niyo yung placement ng ating ECG. So review na lang ulit natin yan. Next, ito, importante. Yung ibig sabihin, tapos natin ito, di ba? P-wave represent atrial repolarization. Meron bang repolarization? Nakikita ba sa ECG ang atrial repolarization? Hindi. Ang nasulat nyo na dyan, therefore, ay yung PR interval. Ang normal mo dyan ay 0.12 to 0.20. Below that, ibig sabihin, meron tayong heart block. Okay? Below that, kasi it's odd, tignan natin. Travel from SA to AV. Okay, it's a time, the time wherein the travel of signal from SA, okay, yung sa SA node natin to AV node, that is your PR interval. Any delay, so ibig sabihin kung below 0.12, yung makikita natin dito sa PR interval, ibig sabihin meron tayong heart block. Discuss natin yung types of heart block later on. For heart block, ano yung kailangan natin? Pacemaker. Okay, QRS complex below or 0.12 below dapat yung normal natin. Again, any delay sa ventricular depolarization, ibig sabihin kung more than naman 0.12 ang QRS complex natin, ibig sabihin merong delay sa signal. That would also mean a presence of heart block. Hindi lang heart block. Or baka may problema ka sa contraction, mayroon kang myocardial infarction kasi walang blood supply sa myocardium. So there are many possible reasons. Okay? Next natin is the segment, alam mo na yan, TV. Okay. Alam mo na to, alam mo na rin yan. Ano bang effect ng beta blockers sa heart? Decrease heart rate. Choice ba natin ng beta blockers sa hypertension?
Yes.
Bibigay ba tayo ng beta blockers sa pasyenteng may hypertension?
Yes.
Yes or no?
Yes.
Eh merong sakit sa puso na may hypertension? Hindi pwede. Okay, mamaya discuss natin yan. MI. Okay. Ang tatandaan lang dito, class, dito sa ECG changes, itong hypokalemia and hyperkalemia. I'll be forwarding the note, pero alam nyo na, yung U wave at saka yung tall peak T wave. Yan lang ang tatandaan natin dyan when it comes to your cardiac dysrhythmia. Okay, next natin yung Holter monitoring. Holter monitoring, class, is an ECG. ECG yan. Okay? Na 24 hours ang monitoring. Nakabit yan sa pasyente. It's a 24-hour ECG monitoring. 24-hour ECG monitoring. So pag sinabi kong Holter monitoring na 24-hour ECG monitoring, tatanggalin mo ba yan kung maliligo ang pasyente? Hindi, 24 hours na yung monitoring natin. What's the purpose of your Holter monitoring? To check, sulat, to check if what activities that could cause cardiac dysrhythmia. Okay? Ang purpose ng Holter monitoring natin is to check for activities that could cause cardiac dysrhythmia. Now, if there are activities na nagkaroon ng cardiac dysrhythmia, kailangan mo i-record yan. Meron ka dapat diary. Okay, at i-record mo yung result natin kung ano yung mga activities that could cause cardiac dysrhythmia. Kasi probably yun yung mga iwasan nating activity. Okay? Purpose of your 24-hour ECG monitoring or Holter monitoring, okay, to record activities that could cause cardiac dysrhythmia. Aside from your Holter monitoring, meron din tayong tinatawag na stress test. Okay? Stress test. Parang ganun din sa Holter. Pero iba ang reason why you do your stress test. Okay? Stress test, ito naman gagamit ito, ano yan, yung treadmill. Okay? Ito naman yung stress test, ito yung treadmill or your treadmill test. Okay? Okay? Stress test or treadmill test. Ito naman, papatakbuhin mo yung pasyente sa treadmill. Okay? While running using your treadmill, okay, you want to determine if magkakaroon siya ng chest pain. Okay? Ang purpose naman yan is to detect presence of your chest pain. Okay? Treadmill, using your treadmill. Pag may chest pain, mag-stop ka na. Okay? Stop mo na patakbuhin yung pasyente. Now, ano pa yung purpose ng stress test natin? Stress test using a treadmill to determine yung presence ng chest pain. Ginagamit ang stress test to check if the medication or the therapy is effective. So ginagamit natin yan if your therapy or treatment is effective. Kung walang chest pain, ibig sabihin yung medication or treatment mo ay effective. So ginagamit yan to check the effectivity of the medication or the therapy. Okay? Another, ginagamit din ito for what? Rehabilitation. Okay? Rehabilitation. For example, nagka-MI, and you want to test if okay na mag-move yung pasyente ng vigorous. After MI, bawal mag-vigorous movement because you want to decrease cardiac workload and decrease oxygen demand of the body. Okay? Ngayon, paano malalaman kung pwede na siyang gumalaw-galaw at maglakad ng malayo? Mag-stress ka. Stress test ka. Okay? Pag nagkaroon ng chest pain, ibig sabihin, stop muna, hindi pa pwede. Okay? So, ginagamit din yan for rehabilitation. While using your treadmill, kailangan ang intervention mo dito, naka-rubber shoes ang pasyente. Okay? naka-rubber shoes. Kasi tatakbo yan, kung hindi rubber shoes, pwede magkaroon ng aksidente or injury. So be sure naka-rubber shoes yung pasyente natin. Okay, that's your stress test. The difference between your stress test at saka yung Holter monitoring natin. Ito, we want to determine for the presence of chest pain. Okay, next natin, yung invasive. Ito, pang critical care. Itong invasive hemodynamic monitoring, makikita yan sa ICU. Okay? So, meron tayong invasive hemodynamic monitoring. Dalawang klase yan. Meron tayong CVP, Central Venous Pressure, at saka yung isa yung PAP, Pulmonary Artery Pressure, or meron yung isang klase ng PAP, ang tawag doon Pulmonary Capillary Wedge Pressure, PCWP. Wait lang. Sulat ko yun. Pulmonary, capillary, yung WI, wedge, pressure. CVP and your PAP. Nasulat ka? Tingin mo na sa harapan. Yung CVP and PAP, baka hindi masyado na-discuss yan. Invasive yan. Hemodynamic monitoring. Okay? Sir, bakit invasive? Malalaman natin. Now, CVP, Central Venous Pressure, ang ginagamit na catheter dito ay CVP catheter. Okay? Meron tayong CVP catheter. Sa PAP, ang ginagamit mong catheter dyan, ang tawag mo ay Swansgan catheter. Ang tawag sa catheter ay Swansgan catheter. Swansgan catheter. Okay. Purpose muna tayo. Okay. Para saan? Purpose muna. Okay. Purpose. Okay. Purpose. CVP, you want to check the pressure. You want to check the pressure sa may right side ng heart. Okay? Gusto natin makita yung pressure sa may right side ng heart, particularly sa may right atrium. So basta sa CVP, right side yan. Ang PAP, we want to check for the pressure sa may left side ng heart. Left side ng heart. But you can still check sa right side, sa Swansgan. Kasi sa CVP natin, sa right side lang yan. Ito pwede mo i-check actually yung kahit yung right. Pwede mo i-check. Depende lang sa insertion site mo. Ngayon, i-discuss na natin yung insertion. Saan mo i-insert ang catheter? Okay, next yung insertion ng catheter. Right side, ano ba yung next doon sa right side? Para pumunta yung catheter natin, ano ba yung blood vessel na nandun? Superior vena cava and your inferior vena cava. So, ibig sabihin, ang entry mo dito ay vein. Tama? Common na ginagamit ay femoral vein. Saan yung femoral vein dito sa may singit? Femoral vein. Okay, sa may femoral vein ang common site of entry. Okay? If we want to check for the right side pressure. Okay? Now, sa PAP naman, since we want to check for the left side, the pressure on your left side, pwede ang entry niyan, pwedeng vein, pwedeng artery. Pwedeng vein, pwedeng artery. Pag artery, edi femoral artery, brachial artery, papunta sa may aorta. Diba? Papunta sa may aorta. Or pwede rin sa vein. Femoral vein, right atrium, right ventricle to your pulmonary artery, measuring the left side. So pwede nga, sabi ko nga pag sa pap, pwede pati yung right side mamimessure mo. Kasi dadaan yan saan? Sa right side. Nakuha. So ang entry mo ay a vein and an artery. Now, so dito pa lang, vein and artery, after the procedure, kailangan mo na ng ano to? Pressure. Kasi ang entry site mo dyan ay a vein or an artery. So, kailangan ng pressure. If the common site is the femoral artery and the femoral vein, paano ang position ng pasyente. Kailangan naka-straight lang yung paa to provide compression. Tapos syempre, ice, compress for vasoconstriction. And ano pa yung intervention mo after the procedure? Limit mo muna ang activity. Hindi ka pwede magagalaw muna, hindi baka magkaroon ng bleeding yan. Okay? So after the procedure, pressure, hold, compress, limit the activity. Kung femoral vein artery, ang posisyon ng pasyente, nakasupine at nakastraight ang legs to promote pressure. Okay? So pressure principle natin after the procedure. Now, ano yung normal na reading? Okay? Ano yung sir? Bago yung normal na reading, sir, paano muna gawin? Paano muna gawin, sir, ang CVT at saka ADD? Now, pakitaan mo kayo ng picture pero i-discuss ko. Okay. So, ito yung example ng CVT natin. Meron tayong manometer. Yung manometer mo, may pressure yan na i-monitor. May pressure yan na monitor or pwedeng centimeter of water ang gamit. Ito yung IV natin. Ito yung 3-way cuff natin. Okay? Papunta sa pasyente, papunta sa manometer, at papunta sa intravenous. O, ganyan yan. Okay, sir, paano nga gawin? Okay, wait lang. Drawing na lang tayo. So, for example, yung 3-way cuff natin, tatlo yan. 1, 2, 3. Ito, papunta, ito, IVF yan. Okay, IVF yan. Okay. Ito, yung ating manometer. Okay. Yung manometer natin, manometer. Ito yung nakakabit sa pasyente, sa patient yan. Before the reading, anong unang gagawin? Before the reading, ang unang gagawin dyan, i-close. Sa gitna niyan, merong iniikot yan na parang tornilyo. May ikot na parang tornilyo yan. So, iikot mo yon, i-close mo ngayon. I-close mo yung papunta sa pasyente. So, ang naka-open ay yung IV at saka yung manometer. Ngayon, normally, yung IV mo, syempre, tataas yan. Okay, tataas yan. Okay, sorry. Baliktad po. Wait lang. Plus. Wait. Okay, ulitin natin. So, yung ating 3-way cup, merong tornilyo dyan. Okay, may tornilyo dyan. Ang unang gagawin natin, i-close mo muna yung manometer. Close mo muna yung sa may manometer. Sorry. Close mo muna yung sa may manometer. Ngayon, pupunta yung intravenous papasok sa pasyente. Diba? It's either a vein or an artery. Papasok ngayon yung IVF mo sa pasyente. After that, okay, i-close na natin. After pumasok ng intravenous fluid, i-close ang next naman natin ay i-close natin. Okay? I-close natin doon sa may patient. I-close natin doon sa may IVF. Sorry. Close na sa IVF. Okay? So that, anong mangyayari dyan? Pag close sa IVF,
backflow.
Yung fluid mo dito from your patient, magba-backflow. Going to the manometer. Mga backflow yan, going to the manometer. Yung manometer mo may sukat-sukat yan. Okay? 5, 10, 15 centimeter. Ang normal mo, CVP reading, mo ay nasa 5 to 12 cm of water. Okay? Nasa 5 to 12 centimeter of water. Or, ito sa may right atrium. Pag sa superior vena cava, 0 to 12 yan. Kunwari yung tube mo, ulitin natin. Dito na sa harapan para mas ma-analyze natin. And then nag-insert ako ngayon ng tube sa may femoral vein. Kasi nga, sa my right side, ang titignan kong pressure. So pag-insert ko ng tube, normal lang na mayroong tingling sensation. That's the catheter that is being inserted. Parang may tingling sensation. Ngayon yung tube hanggang sa may SVC, okay, mapunta sa may right ventricle. So yung end ng tube natin ng catheter nasa may right ventricle. Ngayon, yung 3-way cup, i-open mo yung IVF and patient mo na. Ipapasok ngayon ang IVF. Pasok yung IVF. Then after that, i-close mo yung IVF, i-open mo yung sa may manometer. Ang mangyayari doon, yung in-infuse mong IVF, magbabackflow yun papunta sa may manometer. Ipagpunta sa may manometer na ganyan, ang normal reading natin, if the tip of the catheter is on the right atrium ay 5 to 12. Pag yung tip ng catheter nasa may superior or inferior vena cava ay 0 to 12. Ngayon, sir, if it's below that, ngayon sir, pag below 5, anong ibig sabihin? Hypovolemia. Hypovolemia. E pag above 12, hypervolemia. Ngayon, question, mag-i-increase ba ang CVP reading kung mayroong right-sided heart failure? Yes or no? Yes. So, pwedeng gamitin as a diagnosis saan? Congestive heart failure. Pwedeng gamitin as a diagnosis for congestive heart failure. Nakuha na ba class itong 3-way cup natin kung paano gawin? Now, while doing the procedure, both PAP, unahin ko muna yung, next muna yung PAP bago ko sabihin yung position and all. Sa PAP naman, sabi natin, ang entry site mo ay it's either an artery or a vein papunta sa may left side ng heart. Okay? Papunta sa may left side ng heart. Kung kung artery yan, aorta to your left atrium. Tama? Left atrium ba or left ventricle? Left ventricle, then papunta sa may left atrium, and then pwede ma-check din yung pressure sa may lungs natin. Okay, sa PAP naman, ang difference ng PCW, pulmonary capillary wedge pressure, yung PCWP, naka-anchor lang yan sa may pulmonary artery. Okay? Yung PCWP, naka-anchor yan sa may pulmonary artery. So, ibig sabihin, ang entry site ng PCWP ay vein or artery?
Artery.
Anong entry site ng PCWP? A vein or artery?
Pwede.
Sagot?
Both.
Vein.
Ay, vein.
Kasi napapunta sa SVC, right atrium, right ventricle to pulmonary artery. So, ang entry site ko dito ay vein. Ito ay artery. Kasi yan pupunta yan sa may left atrium hanggang sa may lungs mo, sa pulmonary vein. Nakuha pa, pag hindi mo na-memorize yung anatomy dun sa wala na, litong-lito ka na dyan, class. Ngayon, ito, naka-anchor lang yan. Naka-anchor lang yung aking catheter sa may pulmonary artery. But it measures the left side, okay, the pressure on your left side of your heart. Ang normal natin sa normal natin sa dito ay nasa 4 to 12. Okay, 4 to 12 millimeter of mercury. Normal natin, nasa 4 to 12 millimeter of mercury. Don't worry, forward ko kung mismong buhat na yan. Normal natin, nasa 4 to 12. Okay, 4 to 12. So, kung normal mo sa PAP ay 4 to 12, kung ang normal natin ay nasa 4 to 12, kung ang normal natin ay nasa 4 to 12 millimeter of mercury, kung more than 12, anong ibig sabihin? Mataas ang pressure sa left side. Kung mataas ang pressure sa left side, ano yun? Meron tayong left-sided heart failure. Congested kasi yung left side. Meron tayong pulmonary hypertension. Pulmonary hypertension. Pulmonary hypertension. Okay, more than 12, okay, meron tayong left-sided heart failure. Ibig sabihin congested sa left side, and ibig sabihin din dyan, congested din yung ating lungs. Congested din yung lungs natin. Okay, interventions natin, PAP at saka PCWP. Before the procedure, kailangan ng culture and sensitivity testing. CNS, culture and sensitivity testing, doon sa may entry site mo. Kunwari nakakabit, yan kasi is invasive hemodynamic monitoring. So, ibig sabihin ito, continuous yung monitoring mo dyan. Now, kailangan ng culture and sensitivity testing doon sa site of entry to check for presence of infection. Kasi ayaw natin pumasok yung microorganism doon sa site. Remember, monitoring continuous yan na nakabit yung catheter mo to monitor the pressure sa right or sa left side ng heart. So, para saan ito ginagamit kung PAP-PCW? Pag ang pasyente ay unstable. Pag unstable. Next, kailangan yung zero sa manometer, yung zero sa may manometer, nasa level ng heart. Saan yun? 4 to 5 intercostal space, mid-clavicular. Kailangan nasa level ng heart. Yung transducer mo, di ba yung transducer mo, may zero yan. Yung zero niyan, dapat ka-level yan ng heart mo. Ka-level ng heart. So probably, nasa semi-fowler, 30 siguro, head of bed elevated ka. Okay? Or dapat nasa level ng heart yung ating manometer, yung 0 point niya nasa level ng heart natin. So that's your intervention before. After, alam mo na, kailangan ng pressure. Kailangan ng pressure. Okay, o review ulit natin. Okay, ito yung ating Swan Ganz catheter. So pwedeng pumasok yan dito. Ano dito? Intrajugular vein. Diba? Sa intrajugular vein. Or dito, sa may femoral vein or femoral artery. Ito, ginamit dito ay PAP, sa femoral artery. Ayun, red. Red is oxygenated. So, pulmonary artery. So, pumasok sa may aorta hanggang sa may left side to check the pressure on the left side. An increased pressure on the left side, ibig sabihin, incompetency myocardium sa may left side ng heart natin. Left-sided heart failure or pulmonary hypertension. Okay. So, ito naman yung PCWP. Yung PCWP natin, ang entry site niya ay saan? Sa vein. It passes the right side of your heart papunta sa may pulmonary artery at ia-anchor nila dyan. Ia-anchor nila dyan to check the pressure. Okay? Okay. So, tignan nyo natin class. Ito, exercise. Quiz dapat to, pero sige na. Number 1, sabihin nyo kung CBP, PAP, or both. Number 1, anong sagot natin?
Both.
Measures cardiac output?
Both.
Both. Okay. Next, uses Swan Ganz catheter?
PAP.
PAP. So, PAP. Ito, both. Inserted in a major vein. Example, jugular vein.
CVP.
CVP ba?
Both.
CVP or both?
Both.
Both. Diba? Pwede rin kasi sa PCWP, vein. So the answer here is both. Monitors the pressure in your right atrium.
CVP.
Both. Kasi dumataan din yung PAP sa my right ventricle or right side. So the answer here is both. But what specifically measures sa right atrium is yung PAP or CVP?
CVP.
CVP. If it's below 5, anong ibig sabihin? Hypovolemia. Okay. Confirms pulmonary hypertension. Ha? PAP. PAP or PCWP. Next natin, true or false. Next, true or false. 1. Caffeine is discontinued before ECG. True. Because caffeine could cause cardiac dysrhythmia. So number 1 is true. Next, echocardiogram is the first test is if it is suspected for cardiac condition. True or false? Echocardiogram? Echocardiogram is your 2D echo. Magkaiba yun, class. Okay? So this is what? False. False. Iba yung echocardiogram sa ECG. Ang echocardiogram ay 2D echo. Ang echocardiogram is like an ultrasound of the heart. Okay? But the first test being done kung meron ng cardiovascular problem ay ECG, not echocardiogram or 2D echo. Ginagawa yung 2D echo natin to check for abnormal structures in the heart. Ito ay gumagamit ng ultrasound. Okay? Ultrasound. Ano yung there are two types of ultrasound. Sige na, i-discuss ko na. There are two types of ultrasound when it comes to your echocardiogram. Echocardiogram directly into your heart using ultrasound waves. Or, meron tayong tinatawag na transesophageal echocardiogram. Ang transesophageal echocardiogram ay mas reliable compared sa 2D echo na direct lang na i-ultrasound yung heart ko. Ang transesophageal echocardiogram papapasok yan ng catheter. Okay? Kasama ng catheter ay yung ating echocardiogram. Mas malapit kasi ma-assess yung heart kung via transesophageal. Echocardiogram din yan, pero ito nagpapasok yan ng catheter through your esophagus. Kaya tinawag siya transesophageal echocardiogram. However, any na pinasok mo sa mouth, okay, endoscopy, ipaparalyze mo sino? Si gag reflex. So, kaya ipaparalyze mo yan si gag reflex. Okay? So that after the procedure, ang pasyente ay naka-NPO. Wait for the return of your gag reflex. Kasi dito, pinaralyze mo ang gag reflex so that you could insert easily or comfortably yung transesophageal catheter natin for echocardiogram. Kuha. Okay, kapag mag-ultrasound ka ng abdomen, ano naman yung intervention mo?
Check gag reflex before eating food.
Ha? Naka-NPO ka, na-empty the bladder kasi baka ma-ultrasound mo ay yung bladder. Pero yung bladder naman ang i-ultrasound mo. Anong intervention mo?
Magpahingi.
Full bladder. Full bladder. Full bladder naman pag yung bladder ang i-ultrasound para mas maganda makita yung kanyang structure. Kuha natin. Transesophageal. Familiar ka na dapat sa mga ganon, sa mga diagnostic test natin na common. O paralyze ang gag reflex dito because of the insertion. So, any na ipapasok kay endoscopy, ito lagi lahat ang intervention natin. Okay? NPO after, until gag reflex returns. Okay, that's for your number. So, number 2 is false. Kasi ang sagot dyan ay ECG. Ang sagot dyan ay ECG. Number 3. AST is more indicative of liver function than ALT. The answer is false. Di ba mas reliable ang ALT, yung alanine aminotransferase AL as in liver. Number 4. Monitor for prothrombin time. It 2 to 2.5 times the normal value in patients taking heparin. False. Dapat ito ay warfarin or coumadin. Number 4, therefore, is false. Number 5, coumadin and heparin can be given to a patient at the same time. The answer is
True.
true. Pero coumadin and aspirin, false. Okay. That's for your practice exam. Ay, meron pala dito. Nasabi ko na. Ito yung echocardiography. Okay. Naka-sidelining, okay, sidelining yung pasyente. Ito naman yung ano pala dito? Pinangunahan ko. Transesophageal echocardiogram. Papapasok ng catheter, okay? Then, they will take a 3D view of the heart. Mas reliable ito compared doon sa echocardiogram. Why? Mas malapit kasi yung distance niyan sa heart than yung echocardiogram natin. Okay? Okay, let's return sa esophageal echocardiography. Nasabi ko na rin ito, stress testing, exercise test, or treadmill test. Okay, ano yung gusto natin malaman dito? With presence of chest pain. Eh, saan naman yung cardiac dysrhythmia 24 hours? Holter monitoring. Yung Holter monitoring. Alam mo na yan, chest x-ray, inhale, then hold the breath, then take ng x-ray, bawal ang metallic objects. Alam mo na yan? Ato, cardiac fluoroscopy. Okay, cardiac fluoroscopy. Purpose of your cardiac fluoroscopy, okay, fluoroscopy, ibig sabihin, dito gumamit tayo ng dye. Okay, gumamit ka ng dye. Mag-i-insert ka ng catheter. Insert ka ng catheter, pwedeng sa vein, pwedeng sa artery. The main purpose of your cardiac fluoroscopy, okay, the main function of your cardiac fluoroscopy is to check for a narrowed artery. Okay? Narrowed artery. So mag-insert ng catheter hanggang sa may ating coronary artery, for example, then mag-i-insert ng dye, mag-i-inject ng dye, and then kukunan ng X-ray film. To check specifically kung nasaan yung obstruction or nasaan yung merong narrowing ng artery. Since gumamit ng dye yan, alam mo na yung intervention mo. What is the correct intervention of patient undergoing cardiac fluoroscopy or arteriography using a dye? The correct intervention of the nurse after the procedure is letter A, increase oral fluid intake. Letter B, check for the creatinine level. Letter C, check for shellfish allergy. Letter D, instruct the patient to remain still during the procedure.
Allergy. Allergy.
Anong sagot natin?
Iodine.
Ha?
Iodine allergy.
Answer is letter?
C.
Lahat ay correct. Lahat ay correct. Pero ang tinatanong ay after. Ang tinatanong ay after. Okay, the answer is letter? Letter A. Increase oral fluid intake. Careful ka sa ganun. Baka isagot mo agad letter C kasi tayo siya. Alam mo yan eh. Shellfish allergy. Okay? Pero yung letter, yung before, okay, yung shellfish allergy. Parang yun. Ano pa? I-check mo rin ang kanyang creatinine. Kasi kung mataas si creatinine, hindi ma-excrete ang dye. Hindi ma-excrete ang dye. Yung letter D, correct din yun, but that is what? During the procedure. Correct din yung letter D. Pero ang tinatanong kasi ay after. Increase oral fluid intake is correct. After. So careful tayo sa ganon. Baka hindi mo nakita yung time element na after, during, before, post, pre, hindi mo nakita. Pero alam mo yung concept agad-agad. Letter C, ito dahil ito kasi allergy. Hindi mo nakita yung element ng time. Mamamali ka na doon sa sagot mo. Ang tanatanong doon ay after. Okay, pagpasok ng dye, normal ba na warm yung feeling?
Yes.
Yes, normal lang na warm ang feeling. Okay, that's for your cardiac fluoroscopy, gumagamit ng dye, and then x-ray, yung cardiac catheterization na tayo. Cardiac catheterization, purpose of your cardiac catheterization is both a diagnosis and a treatment. Okay? Cardiac catheterization, purpose of that is both a diagnosis. Minutes. Ano ito? Okay. Cardiac catheterization.
Pare ko. Kapatid mo? Wait. Mas maganda ka.
Okay.
Hindi mabutan yung request of APR. Edit tayo ng program lang yan. Tapos yung mga JPL boss, ganun lang. Ayun. Diba? Oo. Kasi pagkaan sa gano'n mo, budget pa.
Sam, ay namin na. Last na class before break. Last na lang para makapag-break na tayo. Then mamaya, diseases, mabilis na lang tayo doon. Kasi na-discuss na natin yung laboratory and even the methods. Okay, cardiac catheterization.
Purpose kami. Narinig ba sa likod? Narinig ba? Purpose of your cardiac catheterization is both diagnosis and treatment. Okay? Both diagnosis and treatment. Lakad na lang ako para both diagnosis and treatment. Diagnosis, papasok yung catheter. Okay? Number one, that is to check for the pressure sa right and left side. Tapos na natin yun, CVT and your PAP. Another purpose of your catheter is to check for the presence, yung exact location ng thrombus or embolus by using a dye. Ang tawag doon ay arteriography or angiography. Okay? Gagamit ka rin ng catheter doon. Okay? Gagamit din ng catheter doon para ipasok yung tube, then mag-i-insert ng dye, then kukunan ng x-ray film to check kung nasaan yung ating location ng thrombus. So, both a diagnosis. Okay? So, yun yung diagnosis na part ng catheterization natin. Okay? Sir, bakit ginagamit ang cardiac catheterization as a treatment or therapy? Treatment or therapy, saan ulit yun? Yung meron tayong thrombus formation or embolus doon sa may coronary artery.
Lada.
Anong sakit ulit yun? Angina. At saka yung isa myocardial infarction. Mag-i-insert ka ng catheter ngayon papunta doon sa may coronary artery. And aside from the catheter, mag-i-inflate ka ng balloon. Ang tawag doon, angioplasty. Okay? Ano yun yung balloon transcutaneous balloon angioplasty. Mag-i-insert ka rin ng catheter. Okay? Purpose niya, sir, bakit ka mag-insert ng catheter? Para mag-inflate ng balloon. Balloon angioplasty. Pag nag-inflate ka ng balloon angioplasty, so treatment siya. Treatment, ito yung tinatawag nating balloon angioplasty. Okay.
Okay, yan. Okay, so treatment siya, insert ka ng catheter into papunta doon sa may coronary artery and mag-i-inflate tayo ng balloon, yung transcutaneous balloon angioplasty. Angioplasty. So, this is your coronary artery. Insert yung catheter dyan, then mag-i-inflate ka ng balloon so that magkaroon ng revascularization. Okay? Magkaroon ng revascularization of your coronary artery.
So, ibig sabihin, ginagamit natin yan ang management for your angina and MI. Balloon angioplasty. Transcutaneous balloon angioplasty. Where we insert catheter, then mag-i-inflate ng balloon para bumuka yung ating coronary artery. Nakuha na.
Parehas po yun, sir, sa PTC.
Yes, percutaneous. Percutaneous balloon angioplasty. So, catheter din yun. Catheter, cardiac catheter din yun.
Cardiac catheter din yung percutaneous
Transluminant.
balloon angioplasty. Same lang. That is a catheter inserted. So, ginagamit siya both a diagnosis and a treatment. Treatment, pwedeng angiography, pwedeng arteriography, to check yung presence, yung exact location ng ating thrombus or embolus. Treatment siya pag nagkaroon ng balloon angioplasty para i-revascularize yung narrowed or yung coronary artery na mayroong thrombus, okay, para magkaroon ng perfusion ng blood natin. Gets? Now, after balloon angioplasty, pwede kasing mag-clot ulit. Pwede ulit mag-narrow or mag-form ulit ng thrombus sa may coronary artery. Therefore, to prevent na bumalik yung narrowing at saka or yung thrombus, maglalagay tayo ng stent. Maglalagay ka ng stent. Okay? So, balloon angioplasty with stent. Yung stent parang filter yan, okay, na nakalagay, cylindrical implant yan. Cylindrical implant, okay, so that continuous ang pag-compress ng ating thrombus. Kasi pwede kasi thrombus mo, pag tinanggal mo yung balloon, pabalik ulit yung thrombus. Okay? Pero para continuous na ma-compress, ma-revascularize yung coronary artery, maglalagay ng stent. Okay? Cylindrical instrument to permanently compress the thrombus. Ang tawag doon, yung ating stent. So, pwedeng balloon angioplasty with stent. Pero kung wala nang silbi, hindi mo ma-save. Like, for example, with the case of MI, ang gagawin mo na dyan ay yung coronary artery bypass graft. Okay? Ang gagawin mo na yun to revascularize because probably nagkaroon ng infarction, aneurysm of the coronary artery, papalitan mo na, mag-grafting ka na. Coronary artery bypass graft. Now for the cabbage, ang pwede mong gamitin sa cabbage ay, ano yun? Yung ating, pwedeng gamitin dyan yung ating saphenous vein. Okay? Ano yung ginagamit mong pangpalit doon sa coronary artery mo na infarcted at hindi na, at wala nang silbi? Si saphenous vein or yung isa, si internal mammary artery. Ano yung mga pwede mong gamitin as a graft? Okay? Internal mammary artery. Ano yung ginagamit natin dalawang blood cell sa grafting? Sagot, saphenous vein and your internal mammary artery. Or pwede kang gumamit ng synthetic na blood vessel. However, if synthetic yan, forever ka magte-take ng immunosuppressant. And of course, pag meron kang grafting, to prevent further thrombus, magte-take ka ng anticoagulant or aspirin. Okay? So as a maintenance for that, magte-take ka pa rin ng aspirin. So that's for your cardiac catheterization. O yung picture na tayo. O yan, ito yung sinasabi kong stent. Ayan yung balloon. Ayan yung balloon. Ito yung stent. To prevent so that your thrombus will not go back to its original state. Kailangan i-permanent mo i-compress yan by putting a stent. Buka natin. Yan yung balloon. Ayan yung stent natin. Okay. That's your catheter. Ang ginawa dito, may tie yan. To check kung saan yung exact location. O, yan yung pag-insert ng catheter natin sa may femoral artery. Okay, ito yung sinabi kong angiography and arteriography. Cardiac catheterization din yan to check yung specific location ng thrombus or embolus. Tapos gagamit ka ng dye, then kukunan ka ng x-ray film. Ito naman yung ating MRI tape, sorry. That's your MRI machine. Alam mo na intervention dyan, claustrophobia, unremoved metallic objects, o alam mo na intervention mo for your MRI. Okay. Tapos na natin. Ito, intra-arterial, na-discuss ko ito nung una, yung first na concept natin, chapter 1. Intra-arterial BP monitoring, yung IABP, di ba? Intra-arterial BP monitoring natin if unstable yung condition. Next mo na dyan yung mga diseases na. Matapos na natin yan mamaya. So, break muna tayo, 15 minutes, and we continue our discussion.